Hi everyone, it's Belinda Kirkpatrick here. I'm a naturopath and a nutritionist, and I've got over 17 years of clinical experience. Today I'm going to chat to you about PCOS. PCOS stands for polycystic ovarian syndrome and is a really common hormonal condition suffered by around about 10% of women. So it's a pretty common one. Now, what is PCOS? So PCOS basically is a condition, it's a bit of a hormonal and metabolic condition. So the name PCOS can be really confusing because people think that just having multiple cysts on their ovaries might be PCOS, but some women will actually have PCOS and not have multiple cysts on their ovaries. Other women will have multiple cysts on their ovaries and not have PCOS. So it's really confusing and it gets misdiagnosed all the time. So PCOS basically is diagnosed when a woman has two of the following three categories. So they need to have either irregular or absent menstrual periods, so irregular being longer than 35 days or absent not being there at all. Symptoms shown on blood tests of high testosterone, so things that they might show clinically might be things like male pattern hair growth, hair loss on the head, acne, oily skin, and then maybe polycystic ovaries as well. With younger women, you can't actually diagnose polycystic ovaries on ultrasound for at least 8 years after the first period. So it's not just a hormonal condition. The high testosterone also affects ovulation, and then it's also associated with things like high cholesterol, insulin resistance, and blood sugar issues as well. So it really is a whole body metabolic condition that needs to be looked at. So symptoms, as I mentioned before, are either really irregular periods or not getting periods at all. Excess hair growth for women, often in unwanted places. Oily skin, acne, often unfortunately not only the hair growth in unwanted places, but also maybe thinning hair on the head as well. So these are the most common symptoms that you'll get with PCOS. On blood tests, they'll often also show insulin resistance in addition to the high testosterone and hormonal imbalances. So luckily, diet and lifestyle can really help with PCOS, and it's often actually called like the diabetes of the ovaries. So going away from sugar absolutely and towards a more lower carbohydrate diet, really focusing on that protein, heaps of fresh vegetables and regular exercise is essential. With PCOS, weight can be normal, or sometimes women might be overweight as well, and weight gain is certainly more easy with this condition, which sometimes makes these diet and lifestyle things harder because you may not be getting the results that you're wanting from your diet and exercise because of the hormonal imbalance. So you can also consider doing the Happy Mammoth Hormonal Harmony. This one's great because it contains chaste tree, which helps to promote ovulation, healthy ovulation at the right time. And also rosemary is one of the ingredients in that, which helps with insulin resistance, and gymnema. Now, gymnema is a herb that's really good for supporting blood sugar levels and insulin resistance. So it's really working on a couple of the different, aspects of PCOS. You can even pull that in with the complete hormonal harmony system, because the Hormone Harmony Plus powder contains inositol, which is really important for keeping those blood sugar levels balanced. And inositol is one of the supplements that I use with a lot of my women with insulin resistance and certainly with PCOS. It also contains that pomegranate juice extract. Now, pomegranate juice extract is phenomenal. It helps to actually lower testosterone, but won't lower it if it's not already high. So it normalizes testosterone, which I always think is pretty cool, and also helps with the insulin resistance as well. So that one's absolutely fantastic to kind of put in there. The collagen powder, which is the other component that you get in that package, is also fantastic because you really need to be making sure that your gut health is tip top whenever we're looking at hormones. Our digestive system is one of the ways that we actually metabolize and excrete our hormones, and our gut can actually make hormones and really help to kind of balance them as well. So you're wanting to be looking at all those aspects, but certainly when you're looking at that diet and lifestyle stuff, really increasing resistance exercise, reducing and avoiding sugar is absolutely a must for PCOS. Thanks, guys.